Hi, everyone, and welcome. I'm Dr. Johnson with Alterman and Johnson Family Chiropractors, and you're joining us for Q&A with Doctors A and J. And what we're doing with this series is bringing resources to those people in our community, especially now when we're sort of living in this virtual world, wanting to just bring as many resources to you as possible, and resources that are in line with what we teach in a chiropractic lifestyle. And so, you know, what we're talking about today is so crucial to that lifestyle when it's possible, and that's breastfeeding. So Jess Willis is here with us. Hi, Jess.
Hello.
Thanks for joining us.
Thanks for having me.
Yeah, you're welcome. So Jess is a lactation consultant. She's an Ibclc, and I'm going to let you introduce yourself and tell us your story about how you came to be a lactation consultant, how you came to be involved with the Leche League.
Okay. So yeah, I'm an Ibclc with Sunshine Lactation. It's my practice, and I am a Leche League leader. I have been volunteering as a Leche League leader for I think almost 10 years now, or maybe it's 9. I don't know. When you have children, the math gets a little fuzzy. And I became a leader because I needed breastfeeding help, and I had a hard time finding it. And there was no Leche League in my area. And so I started working through the process, became a leader, supporting other parents, and then over the years decided that I wanted to learn more and be able to support them more in depth, and became a board certified lactation consultant as well.
So Ibclc, to my knowledge, that's the highest level of credentialing in lactation support. Am I right?
Mm-hmm.
Yes.
Yeah, they call it the gold standard for lactation care.
All right, that's awesome. So I just have to say, and I mentioned this to you early, that I love the Leche League. That was such an important part of my life with my firstborn 30 years ago, and I really encourage all of my moms to get established with a lactation consultant and with the Leche League. And I just have to throw this little tidbit in here that some of my current day closest friends are my friends from the Leche League 30 years ago. So
oh, I love that.
really sweet relationships can get developed.
Yeah.
All right. So here we are in this, you know, what crazy world that we're living in now, and it's affecting all parts of our lives and potentially aspects of breastfeeding. And so I think what we were going to start, we're going to touch on first was breastfeeding with COVID, around COVID, and you know what is the truth about that, and what are the facts about that? So tell us what we can learn.
Breastfeeding is really important for babies and for moms, but it's really important for babies at any time, right? But during a pandemic like what we're going through right now, it is even more crucial for babies to protect their immune systems. There's been a lot of misinformation going around about whether or not it is safe for babies to breastfeed if the mother tests positive for COVID-19. And in short, yes, the World Health Organization, the Academy of Breastfeeding Medicine, La Leche League, all have great information online that you can go and look up about whether or not you can breastfeed if you have test positive for COVID-19 or if you think you have it. Yes, you can, and it is crucial. And so if you are expecting and you are giving birth at home or in a hospital, I want everyone to have that information and knowledge.
So just to segue there a little bit, in a hospital setting, there's some lactation support that's available through the hospital, in every hospital in Jacksonville.
Yes.
For a home birth or birthing center, then those women are going to have to reach out privately, correct? Yes. Okay. Okay.
And we're still offering, I am, and I believe some of the other private practice lactation consultants in the area are still offering home visits as well when needed, or doing virtual consults when it's possible. It's kind of hard to see what's going on with breastfeeding through a screen, but we're doing our best all over the world to figure it out.
Yeah, it's a pretty up close and personal type of support, isn't it? Yeah. So just to go back to this really quickly. So in a hospital setting, women will usually have a meeting with a lactation consultant in the hospital, and then maybe one follow-up visit. But often more than that is needed, and that would be when, even having birthed in a hospital setting, we have lots of private practice IBCLCs in Jacksonville, and you being one of them, of course. Okay, so go on. Is there anything else that you wanted to share about nursing with COVID or with the possibility of COVID? Or
Yes. If a mother does have COVID-19, or if she's ill with something else and unable to breastfeed her child, then she should be supported with expressing her milk or helping her pump her milk to provide her breast milk to her baby. There are other precautions that are listed on the World Health Organization website, like, for example, washing your hands a whole bunch. We're all pros at washing our hands right now. So like if you're pumping, wash your hands before, then pump, and then wash your hands before you pick up your baby. Realistically, what we've always said in La Leche League is that like if you have a cold and you're breastfeeding, most likely you were symptomatic before you knew you had a cold, and your baby probably has been exposed to it already, but your breast milk provides the best immune protection for your baby because your milk creates antibodies up to the moment for your baby, every single moment of every day, like live, perfectly created antibodies for your baby. So it really is the absolute best immune protection that you can provide your child. And if a mother is unable to breastfeed for some reason at all and isn't able to express her milk, then the World Health Organization still recommends donor milk, safely obtained donor milk as an alternative to mother's own milk. And then after that, it would be safely prepared artificial baby milks formulas. And I just want to note really fast that if parents are using formula, powdered formula, they do want to make sure that they're preparing it with boiled water. And that information is also available on the World Health Organization website. I know that not everyone gets that information when they go home from the hospital or from the pediatrician. And it is important to keep your baby safe.
Good to know. Okay, so did we cover that topic? All right, really good information, because I'm sure that moms who either are in that situation or are concerned about that they need to know. They need to know that not only is it safe to breastfeed their baby, but it is still the best thing for baby.
It really is.
And
it's also good for mothers. It's stress relieving, as you know, I'm sure.
Absolutely. So let's talk more about, under normal circumstances, what to expect in those initial days and weeks, and what kind of support you would offer to moms in terms of what to expect and just how to navigate that time.
Okay. Well, to start with, I think it's really important that we have realistic expectations for newborn babies. They're not like what you see in the movies. And a lot of parents might not be able to take a really good birth or breastfeeding class right now that helps them prepare for what to expect. And I hate to say it, but the What to Expect book did not prepare me for what to really expect with a breastfed newborn baby. So it's really important in the beginning to breastfeed early and often. We say this in La Leche League all the time, early and often. And that's because newborns have really, really tiny, like this big bellies, and they digest breast milk really quickly.
Hey, Jess, Jess, I just want to clarify, because we were talking about this earlier. What can people see by the camera on the computer? We're not talking about this big as your fist. We're talking about this big, yes. The little opening between the fingers, right?
Yes, exactly. Like a shooter marble or similar size. And it grows over time. But when they're first born, they have tiny bellies. And when you look at like the measurement marks on the side of a bottle, and they're talking about ounces, that's not how big your baby's belly is. Your baby is not going to take ounces of milk right after they're born. So your milk comes out in drops at first. Colostrum comes out just one drop at a time from your breasts. And your baby has to be there very often to be able to get those drops. They may want to stay on your chest all the time, because your chest is, you know, those little warmers that they have in the hospital rooms? Your chest is the original warmer. It regulates your baby's heart rate. It regulates your baby's blood sugar. They actually did a study that showed that 3-month-olds, when they were placed on someone's chest, they coordinated their heart rhythms with their mother or father. So there's a lot of important things that go on when your baby's right here with you. And it's not just about the breastfeeding, but it has a lot to do with that, because when your baby is here, your baby relaxes. This surge of oxytocin and prolactin happens in the mother's posterior pituitary and anterior pituitary glands that causes her to make milk and bond with her baby and relax. And the baby has some of those same reactions and responses. It can also just being there without the hindrance of gowns and bras and lots of clothing and gloves and stuff. Just having the baby and the mother skin to skin allows them to learn each other, and the baby can learn the mother's bacterial flora on her skin and practice breastfeeding, because it takes work. It's a learning process for both the mother and the baby.
Yeah. So the message is there early and often, and lots of skin to skin in those early weeks, really. Yeah. And then you mentioned something else when we were talking earlier, what to expect from a newborn sleep schedule, I think. Did you mention
or feeding frequency.
Okay.
Normal newborn behavior is so important, just like I said earlier, having the right expectations. If you go home with your baby, or if you have your baby at home and you're expecting your baby to eat every 3 hours, you're going to be disappointed, because, and your baby's going to be a little frustrated with you, because most babies are not robots and they don't eat on a schedule, and they don't tell time. And most newborn babies, like I said, need to feed very frequently. So they can feed, it could be every 45 minutes in the first few days. It may space out after a while to every hour and a half, every 2 hours, every 3 hours or so, and it'll vary. It'll be, you know, your baby may want to feed 45 minutes and then 45 minutes later, and then take a nice long hour and a half nap, and then want to nurse again. So the expectation of babies having some sense of time is that's not accurate. And another thing is your milk is going to change in composition over the first few days. You'll have colostrum in the first 1, 2, 3, maybe a few more days if you have a difficult birth. And then it's going to shift from those small amounts, those drops of colostrum, to more abundant milk. We say that your milk is coming in when that happens, because it can feel like the floodgates open. And when that happens, we really want baby to be able to feed very frequently. And mothers can use massage on their breasts. They can use breast compressions when they're nursing the baby to make sure baby is getting plenty of milk while they're there. And they can also use hand expressing their breasts in between feedings if they're uncomfortable, to prevent things like breast engorgement. Everyone talks about how, like, oh, after my milk came in, my breasts were like basketballs. It was so painful. It hurt so bad. I don't think that that's really biologically what we're supposed to experience. I think that's more likely a result of us not having our babies on there so frequently, or baby not transferring milk effectively because they're learning. So those are, I think, important expectations to have. Let's see what else. And diapers. I did want to touch on this really quickly because this is so important. Newborns should have about 1 wet diaper per day of life until your milk comes in. So like on day 1 wet diaper, and maybe 1 stool diaper, and it'll probably be like black and tarry on the first day. And then like day 2 wet diapers, still maybe black and tarry, maybe turning a little bit like yellowy. Day 3, it should start to transition from that black and tarry to like a greenish yellow, and you should have like 3 wet diapers. And then by day 4, ideally your milk has come in, and after that, you really want to be seeing like 5 or 6 wet diapers a day and at least 1 stool diaper a day. And when you see your babies having plenty of wet diapers and at least that 1 dirty diaper a day, then you know that your baby's getting enough milk from you, because it had to come from somewhere. It comes from you. You're making all that wonderful milk for your baby.
Well, you know what, I think, you know, that's such a simple thing to pay attention to, and it's so basic, but I think most moms need to hear that, most first-time moms, I would say, because, you know, there is a lot of uncertainty around that I hear, you know, wondering whether baby's getting enough, and
right,
baby's unhappy. Is it because
how do I know?
So there you go. Before resorting to weighted feeds or taking any other steps, here are some really basic measures. 5 or 6 wet and 1 poopy.
At least 1 poopy diaper a day tells us that baby is getting enough milk. And you know, even in my practice as a lactation consultant, I often find the baby's output a more effective measure of how much they're getting than weighed feedings, because a weighed feeding only tells us how much that baby is taking in that moment of that day.
Right.
And the amount of milk that you make throughout the day changes from hour to hour, and the consistency also changes. The amount of fat and the amount of milk that your baby is going to take changes from hour to hour. They might not be so hungry for that feeding.
Yeah, that's a really good point.
Really, the overall output, yeah, it's a good indicator. So babies come with their own "I'm getting enough" indicators.
All right, so good. I think that'll give some moms peace of mind, just to know that that's a simple thing that they can monitor for themselves. So let's talk about when is it time to reach out? When should there be a concern that, you know, somebody might want to reach out to an Ibclc, or talk to us about those measures. And
when a mother feels that her baby's not getting enough, if you're not seeing enough wet diapers, but your baby still seems hydrated, and we'll get into the hydration signs in a moment. If you're worried baby's not getting enough for any reason, you can always reach out to your local La Leche League here in Jacksonville, Florida. I volunteer with La Leche League of Jacks, LLLofjacks.org. If you have nipple pain, and that seems to be very common, but it's not normal for breastfeeding. If your nipples hurt while you're breastfeeding, I cannot emphasize this enough. Don't keep doing it in pain. Like, don't continue if you have like sores or bleeding. Get some help right away. Sometimes, as a La Leche League leader, I can guide people through like some different positioning, changing the way they're positioning themselves. I always like to suggest more laid back positioning where you're reclining, semi-reclining in a chair on the sofa when you're feeding.
So can I just interrupt you right here? Because I have to put in the chiropractic perspective. The chiropractic plug for this. I do the same thing for a very different reason, but they go together. As a chiropractor, with a pediatric and a prenatal practice, moms that nurse like this, so they end up with neck problems. We call it new mommy neck. And so reclined or laid back or natural nursing, mom is much more passive and relaxed, and the arms aren't having to engage and hold the baby. in the same way. So for spinal health, this is a preferred method. All right.
I wonder about how like compressing the spine might affect things like prolactin release as well. And so I think
well, I was going to say, I don't know of that specifically, but I do know that there was a study that showed that this sort of forward head posture position is more likely to bring mom more into the sympathetic or fight or flight stress aspect of nervous system function and out of the rest and digest, which is where we want to be for breastfeeding. So,
right, exactly.
So neurologically, we know that there are implications to that. Okay,
yes,
so continue.
And it's more comfortable. And babies are also able to get a bit of a better latch when they're positioned on mom's chest, belly to belly. And if you're leaning back a little bit, it's easier to get positioned that way for baby. Other reasons that you might want to seek help from a electrolyte leader or an IBCLC, if you're supplementing and you're trying to get back to the breast and you're having a hard time, we can always help you come up with a detailed feeding plan. And we mentioned the wet diapers earlier. If your baby's not having enough wet diapers, if baby appears lethargic, there's a little soft spot right here on newborns' heads. If it's sunken in, that's the fontanelle. You always want to check that, your baby's hydration indicator spot. And your baby's lethargic and maybe not having those wet diapers, then that's kind of like an emergency situation where you would probably want to call 911. We always want to make sure that babies are staying hydrated. That's very important. Yeah, if you have any other issues that might not require hands-on help, then your local Lelecia League leaders are here to help you, and we are volunteers. We do it for free as an IBCLC. I'm a home visit lactation consultant. I provide consults virtually through the computer as best I can, or I'll come to your home if needed for hands-on help and really in-depth clinical lactation care.
So I think we covered the main topics that we want to, but before we close, do you have any other words of wisdom that you want to share with moms or words of encouragement?
Sure, I do. You know, this is a really stressful time right now. And being a mother is already kind of stressful in itself. And one of my pet focuses, I guess, as a lactation consultant is on maternal mental health. And it's something that I don't think we get a lot of information on when we have our first child, especially. Having a baby is stressful and hard on you, and it can leave us feeling, it can leave us nutritionally depleted, emotionally depleted, and when we pile what's going on in the world right now on top of that, it can make it even harder. And yes, stress can affect breastfeeding too, so you really want to try and keep your stress levels down. Things like chiropractic care can be really helpful for that. But also things like making sure you're eating really well as you can right now. That doesn't mean like you have to go out and eat a bunch of kale. It can mean like any dark leafy greens. Kales are great, but like broccoli, dark leafy greens are really, really good for breastfeeding mothers all over the world. Every culture has some sort of dark leafy green that breastfeeding mothers eat. Also, I often recommend to my clients that they take a omega-3 fatty acid that's high in EPA, because studies have shown that it decreases the incidence of postpartum depression. And that is so important for mothers right now, I think. And really just take deep breaths and do what you can to take care of yourselves right now. And know that you're doing the best you can for your baby. I know you guys are. and just love on them and snip those baby heads every chance you get. I miss that so much.
In the little neck.
Yes. Oh my goodness. That smell is amazing.
Really
Every time I hold someone else's baby, I'm tempted. I'm so tempted. I miss it.
Oh, Jess, thank you so much. I really enjoyed this time. And, breastfeeding is something that's so close to my heart and that I feel really passionate about. And I support a lot of moms also with breastfeeding difficulties from a chiropractic perspective. So thank you for sharing everything that you have. SunshineLactation.com. And we will also put that with this post. We'll put the link so people can reach out to you and find you if they want. And La Leche League also will be tagged.
You can find the Jacksonville La Leche League group through llofjax.org. It will redirect them to the Facebook page. And then we also have a private Facebook group where parents can join and ask questions about breastfeeding and get help from all of our La Leche League leaders in the area.
Oh, that's wonderful. And especially right now, that Facebook, I'm sure, is busier than ever without, with us not having live.
A little bit busier. Okay. We haven't had meetings in about, it's been almost 2 months, I think. And it's a little sad, I miss it. But we're trying. I'm going to try to do some more Zoom meetings and stuff soon. So
well, you're there for moms in one way or another. And
we're all here.
And they do. All right, Jess, thank you so much. Again, I've really enjoyed it, and I appreciate your input.
Thank you so much.
You're welcome.